Hey guys, thanks for joining me at Nurse of a Few Words, where I say less but do more. And today we're going to talk about different tips for new to nursing novice nurses. So hopefully you'll join with an institution that will have a residency program. And in those programs, they'll help you to develop your critical thinking skills, as well as minimizing safety risk, as well as leadership development, communication skills. So if you get into one of those programs, that'll be a great start because they kind of hold your hand a little bit through the process. They have different training sessions to kind of help you to feel more confident in your practice. And of course, they're going to give you a preceptor. So those are all helpful in starting off as a new nurse. So some key things we're going to talk about today. Biggest thing is being prepared. So if you're starting off as a new nurse, you definitely want to give yourself time to acclimate yourself to your atmosphere, time to acclimate yourself to your patient, their diagnoses, their different problem issues that they've encountered during their hospital stay. And one of those ways you can do that is by coming in a little earlier. Now, mind you, it's not ideal to have to start your shift early, but it can be very helpful because we're in a field of work where things are very sporadic, unpredictable, and things can happen at a flash. So if you allow yourself that extra time, then you'll be more prepared if anything is thrown your way. So coming in early, you can kind of take a look at your patient assignment, determine what their diagnoses are, as well as any problems that they've had during their hospitalization stay, any medications that they're currently on, as well as their condition. You can look at their vital sign trends, their lab trends, all of those things to kind of better inform yourself of your patient and what your plan will be. So it can allow you time to kind of jot down your notes, kind of plan for what your day will include and your different goals for that patient. With that, you can also be kind enough to take report early from the nurse that's going to give you a report. And I'm sure that you'll be a huge hit with that. We love when people come in early so we can give a report and get home. Because by the end of your shift, you're tired. So if you have opportunity to kind of give a report ahead of time and get out of there, you'll be greatly appreciated. And starting off, you're going to have a preceptor more than likely, so they'll kind of guide you through, but this will help you to kind of better prepare yourself. And we're living in the technology era. So you have your watches, people walking around with Apple Watches, you have your phones. You can set alarms for if you have certain things you have to do by a certain time. So you can allow yourself for more efficiency as a nurse. So say for instance, if you have a patient that's on a heparin drip and you need to check their PTT 6 hours after they change the dose, you can set an alarm for that. And if you're there early, you can kind of look at that and plan for that. With that also, getting report, just to mention, you can do bedside report. So with doing bedside report, it's kind of the standard now and most hospitals are encouraging it. You do have a few people that are resistant to the process, but it is very helpful. You can also use your time wisely by giving bedside report. You can look at your patient, you can introduce yourself to your patient and get them familiar with you. You can also state what their goals for the day will be. And you're basically including your patient into their plan of care, which is a great practice. It will ease their anxiety, help them to feel more empowered and included in the situation. So with that, you can talk to the nurse giving you a report as you're kind of assessing the patient, looking at what drips they're on, what medications they're taking. The patient can add feedback to you as well. So it's a great time to kind of just look at the overall picture. You can kind of see what the patient's status is. You can review their vital signs with the nurse giving you a report. If they're on a cardiac monitor, you can review their rhythm to make sure that there's no issues. And also if there are issues, kind of, talk to the nurse giving you a report to see what has been done to address that or what the plan may be to address those things. So it's definitely helpful and it does serve for best evidence-based practice and safety for the patient. And going into that, You're going to also check for safety parameters. If you have a high fall risk patient, you're going to be checking to see if their bed alarms or chair alarms are on. You can kind of assess what their mentation level is, and make sure that everything is set up, the alarms are set up to kind of match and protect your patient as well as you in practice. Outside of that, you're going to be checking your orders hourly, hopefully. Now it gets a little hectic, but it's good to try to check your orders hourly and see if there's any new orders that come in, because not always does the physician communicate with you. So you want to make sure that you're checking to kind of make sure that you stay on task. Another thing that you're going to pay attention to is, biggest thing is safety with medication administration. So they used to say it was the 5 rights of medication administration. Now they call it 6 rights of medication administration. So you want to make sure you have the right patient, the right medication, the right dose, the right route, time, and now right documentation. So you're going to document properly. The good thing with that is you can check your patient's wristband, and it should have their name and their birth date. If they are oriented, you should be able to ask them what their name is, their full name is, what their birth date is, and compare it to their wristband. A lot of hospitals have included barcoding, so you can scan their wristbands with a barcode in place along with the medication. And if there's an issue with the medication, if it's not correct or incorrect time, a lot of times these electronic systems will alert you to that. So that's a safety measure that's put in place to kind of help make sure that you're doing the appropriate thing for your patient. Big thing here when we're talking about medication administration, you want to make sure that you are familiar with these medications and what their actions are. It's really alarming when you see nurses that sometimes they'll give medications without thinking of how the medications work. For instance, there have been times where I'll have a patient, their heart rate, they may be bradycardic, heart rate in the low range. So their heart rate may be 50s, 60s, but you'll see that the previous shift may have given metoprolol. Now, if you're familiar with metoprolol, you know it's a beta blocker. It will decrease blood pressure. It can decrease your heart rate. So a red alarm should go off in your head that, hey, wait a minute, let me think about whether or not I should give this medication if my patient is borderline with their blood pressure or borderline with their heart rate. And not all physicians put order parameters in. So if they don't have order parameters in, it is up to you and your critical thinking skills to make sure that you ask the physician, hey, is this order correct? Are you okay with this medication being administered? And you have to kind of use your critical thinking as well. You can make your shift flow smoothly by being aware of what your medications are and deciding whether or not it makes good sense to give that medication. Because if you have a patient whose heart rate's in the 50s and you decide to give them metoprolol, then all of a sudden you see their heart rate trending down to 40s, 30s, hey, maybe if you didn't give them metoprolol, that wouldn't be your issue. So just be familiar with the meds that you're giving and how they work so that you can kind of use your critical thinking skills to determine whether or not you're going to give those medications. It is helpful to give those medications at the bedside. So if you have a patient that's fully oriented and totally with it, they will at times kind of say, hey, you're giving me this medication. It's good to say to the patient what you're giving them, how the medication is working, and the reason why you're giving them that medication. At times, they will say to you, wait a minute, I stopped taking that medication like several months ago. And you have to listen to the patient because they could be telling you correct information. So trust that the patient's telling you correct information so that you can check with their physician and kind of decide, should they be on this? Did orders change and we just haven't updated those orders? So it's always good to listen to your patients. They know oftentimes more than we do. And I forgot to mention with checking orders, if something doesn't quite make sense or doesn't seem right, check with the physician because unfortunately there are times they have multiple amount of patients. So there may be times that they mix things up and may put one order in for one patient that's not correct, meaning to put in an order for a different patient. So by you paying attention to what your patient's needs are and what their problems are, their diagnoses, you can know if an order doesn't quite match up. For instance, if you have a patient that has chronic heart failure, and then you see that they get an order for a fluid bolus out of nowhere where it doesn't make sense, they have stable vital signs, a light bulb should go off in your head and say, let me check with the physician and make sure this order was correct. Because like I said, sometimes safety measures are put in place, but doesn't always work out. So you have to actually be in tune with that to make sure that you're making the right decision for your patient. Big last point here. As a new nurse, even as an experienced nurse, you're gonna always need help. So don't be afraid to ask for help. We all know that you're just starting off and there are gonna be questions. So ask for help, because a big part of this is teamwork. You're gonna need other assistance from ancillary staff, from your fellow nurses to get through your shift, especially in the midst of this pandemic. No one is a lone soldier. You can't do it by yourself. So don't be afraid to ask those questions when you need help. And that's about it for today. Feel free to like and subscribe, and also leave a comment, and look out for more content. And thank you for joining me today. And good luck out there.